it's Dr. Ellern here at Reflections, and I'm a cosmetic physician, and today we are talking about under eye filler. So in similarity to lip filler, we get a ton of people coming in for under eye filler. Under eye filler is not something like lip filler where most people are candidates. Under eye filler has to be used in specific instances of under eye issues. So today we're going to take a minute to actually go through some before and afters and kind of play a little game and see who we think is a good candidate for under eye fillers and why somebody would not be a good candidate and may need other techniques or technologies or even sometimes surgical intervention to get the results that they are looking for. So we're going to take a look at the first image. You're going to see a nice lady who has a little bit of a half moon kind of indentation under her eyes. This patient has been treated with under eye filler. She's a good candidate because she only has a mild herniation of her fat pad, which is the fat that's kind of bulging out there that's a little more farther beyond. So you can only treat this sort of under eye issue if you have more mild fat pads. Once you get beyond a certain amount of fat pad underneath the eye and a certain amount of droopiness, they become more and more difficult to disguise. And what we're trying to do when we're disguising this area is the indentation that's occurring below the fat pad, we can fill that in and it makes the whole area just look smoother, so it's less variegated in height. As you can see with this next patient, this fat pad is beyond the point of being able to be disguised with under eye filler. So once someone's fat pad gets to this point, we need to really have a surgical intervention in order to achieve the results that are needed. The fat pad would need to be removed and likely fat would need to be transferred under the eye to replace the lost volume that's created by this removal. This would be done by a plastic surgeon, so if that's something you're interested in, you would make an appointment to have a surgical evaluation of that area and discuss what your options would be. For the next patient, she actually was treated with under eye filler as well. Her fat pad is really on the cusp of being too far gone. For her, she wanted to avoid surgery as much as possible, and with the understanding that she was not going to have a perfect result because of the fat pad being further along than most. So there is some ability to disguise the fat pad, and sometimes there's an imperfect result that may be acceptable if people are trying to avoid surgery, with the understanding that that may be their best option. For this next patient, she asked for under eye filler to correct some of her issues. For her, however, the blue cast that's under her eye was actually being caused by a vein. So in her case, the vein needed to be removed with a laser in order to get rid of that bluish hue. She was not experiencing that darkness or the shadowing because of an indentation, which is what filler would be mainly used to correct. The next photo is an image of a young woman who has a genetic predisposition to have under eye hollowing. They are exceptional candidates for having wonderful results from under eye filler because for the most part they just have an indentation. There's no fat pads, there's no other issues usually going on that's creating more obstacles for a perfect result. This patient did excellent, as you can see, has had significant improvement of her under eye appearance. And this next patient, you can see she's also a fairly young woman who has an indentation under her eyes that has been worsening as time has gone on. So filler was placed under her eyes in order to create light reflection under the eyes, which make the skin appear brighter. So when we flatten the skin out and it's not indented, it reflects light better and then appears brighter. So which is why we use highlighters as makeup and things like that to reflect the light. So this is kind of using the light bouncing off to make the skin, which may be a little darker in her case, appear brighter than it would be otherwise. So, and for this next patient, we're taking a look at her under eyes, and this is a common question we get when people come in and they actually have more skin laxity under their eye and crinkliness and think that filler is going to be the solution to that problem. That patient that you're seeing here would likely not be happy with filler because really what she was bothered by is not the indentation or the loss of volume under the eye, but actually the crinkly skin. So in her case, she used RF microneedling with PRP to improve the quality of the skin, to tighten the skin up around the area, making it look less bunched and improving the overall appearance of the under eye, making her look more youthful. This is more commonly done, especially as we age. That kind of happens around the over 45 to 60 age set. This can be a common issue that we also need to address in addition to if there's any hollowing. Alright, so I think we have a better idea of what kind of treatments are done under the eyes and what fillers can and cannot do and who is and is not a good candidate for under eye fillers. So if there's any other treatments you guys would like some information on, please let us know in the comment section. We're also going to put some links down there to have for other things, photo galleries and such for under eye fillers, so you guys can get some more examples of what can be done with the under eye fillers. So if you have any specific questions about your case, you can email us or come in for a free consultation and we can kind of go over a treatment plan with you. We look forward to seeing you here at Reflections. Hope you have a great day.